Others
Acha,
visible?
okay. This is Dr. Sourabh.
Yes. So Dr. Sourabh Patwardhan sir is operating. He is a left-handed surgeon and is operating a mature cataract 75-year-old male patient.
So Dr. Sourabh Patwardhan has the mic because we'll need his inputs how he's managing as a left-handed surgeon.
Yeah. It's always very nice to see a left-handed surgeon. They appear very elegant, and for all of us, it's suddenly a different viewpoint. And it's very fascinating to see a left-handed surgeon.
Sir is left-handed surgeon plus he is left-handed trainer. So for him it is very important to manage the trainee having right-handed incisions. So he has become now bidextrous.
I think that's wonderful.
So I have about a 5.5 millimeter rhexis, perhaps slightly larger. So while making the rhexis, one has to be careful that the cornea has a magnification factor of about 10%. So if what you see is 6 millimeters, what you end up with is 5.5 millimeters. And the interesting part is that the white to white is not enlarged. It's only the pupillary margin and the rhexis that is enlarged. So we're going to start. Hydro per se was not required, but I did little bit of hydro. So this is a 75-year-old gentleman. He has presented with bilateral mat cat. We have chosen the right eye first. And the AC depth is 3 millimeters and the lens thickness is 4.7 millimeters.
Your foot, Phaco foot pedal is you are keeping on the right foot? Or
Yeah. Okay. So I'm a lefty surgeon, but because how things went during residency, I have the foot pedal, the Phaco foot pedal on the right side rather than on the left side.
And Phaco probe is on the left side?
The Phaco is on the right and the microscope foot pedal is on the left.
No, the Phaco probe, you are holding it with
I'm
your...
holding it with my left hand.
Too many crisscross connections.
Yeah. So I can see that there's subtle conjunctival pooling. So I'm just going to lacerate the conjunctiva with my Sinski.
So it's important that when you see the ballooning starting, that time only you remove it, otherwise it becomes 360 degree.
So after every 2 trenches, I try to refocus the microscope at the base of the trench. So what I'm aiming for is a very short but a deep trench. So in sculpting, we require optimum power, low vacuum or moderate vacuum and low flow rate. So
Are there any left-handed surgeons in the audience?
Sir, isn't the chamber very deep for a mature cataract?
The chamber is 3 millimeters and my bottle height is 70 centimeters of water.
No, looking at this current scenario, don't you think you should reduce your bottle height?
Yeah,
making
I
the
think that will be a
small?
good call. Yeah, you can reduce the bottle height. So I want my chop to go all the way, which it has. I have the benefit of a slightly larger axis so that I can take the leeway of inducing a little more lateral separation than normal. So my chop has gone all the way. Now I'm going to subdivide this.
So Dr. Sourabh has raised a very important point that your capsular axis margin, you have to be very cautious. If it is slightly borderline, you have to be cautious that you don't stretch it too much.
So lucky for me that this is a brittle nucleus. It does not have a very tenacious posterior plate. So I have 4 pieces. I'm going to subdivide them into 8 pieces. So making multiple small pieces reduces your net CD. That's the whole point of sub-chopping the pieces. and your chop wouldn't go right every single time. So you have to rehold and sort of chop it again.
You're using Centurion?
Yeah, we are on Centurion with active fluidics with active Sentry hand probe. So I think I have enough pieces. I'm going to go to quadrant mode.
So what is the main difficulty you faced when you started the Phaco?
I think the main difficulty for me was deconstructing what my senior was doing, who was a righty surgeon. So it took me some time to realize how to suture wounds, what should be my hand movements. I think that was the major concern. Another learning curve that I faced was when I shifted to right-handed Phaco for surgical training. So what I realized is having the second instrument in your dominant hand is a superpower. So when I have the Sinski in my left hand, it really helps me propagate a multi-level chop very well. So by and large, I haven't really faced a very big problem shifting to right-handed Phaco, largely because I use the left hand to my advantage.
So if there are any left-handed surgeons, they can contact you?
Yeah, anytime. So I am about 900 cases old, so not very experienced as such, just stupid enough to say yes to a live surgery.
No, you're doing very well.
Yeah. Thank you, ma'am.
Yes, hello. Hello.
You're audible.
Yes, very well done, Sourabh. Sourabh to Sourabh. Now we'll move on to Dr. Indranil's case.